Hello there. This is Cassie Cannon. I'm a licensed clinical psychologist. I'm certified as an EMDR clinician and certified as an EMDR approved consultant. And a question that I get a lot is, how do I write a master treatment plan? This video is specifically for clinicians, though if you are a client or a potential client, this also could be really helpful for you to understand how your treatment trajectory might look. Now, I want to have this disclaimer, which is that this information is meant to be a supplement to formalized EMDR training, and it's not meant to replace said training or additional consultation. And then here is just kind of a quick visual overview with diagnosis, history and treatment planning, EMDR prep, EMDR targets, and treatment plan updates. So the first section we're going to look at is diagnoses. And there's a zoom in there for you. Now, depending on the location where you work, your master treatment plan requirements will vary. Personally, I'm in private practice and I'm self pay only, so no one has ever really asked for my master treatment plans, but I do like to make them and discuss them with my clients. It helps both of us observe the progress that they're making in treatment, and it also helps guide the entire experience. So, if you are at an agency or if you accept insurance, there may be specific guidelines in how your master treatment plan needs to look. So, what I have here is just a framework that you can adapt to whatever type of plan you need to write. So, in general, though, you will need some sort of diagnosis, which is why I have at the top here F43.10 post traumatic stress disorder as an example. That tends to be the most common diagnosis that I use. Now, beneath that, we've got goals, objectives, and interventions. Many agencies will require this. Um, and you can do these goals, objectives, and interventions for each major block. For the purposes of this video, I just did a general because personally, I actually don't even use these in my own master treatment plans. When I'm reviewing them with clients, they really just care about the interventions, which is mostly what you'll be seeing below. But the goal is supposed to be that overarching main goal. And so for this person, we're choosing to improve functioning within the client's relationships, including with the spouse and their employer. The objective is a smaller breakdown of goals that will help you, or smaller objectives that will help you meet that goal. And they're supposed to be measurable to some degree. And so for this one, I have decreased symptoms of intrusion, avoidance, alterations in cognition, mood, arousal, reactivity, which are the symptoms of PTSD, as measured by the PCL-5, which is the post-traumatic checklist for the DSM-5. And then below, these are actually the specific interventions that I use. And so moving on, we're at the next section, which is history and treatment planning, which you see is phase 1 of EMDR's 8 phases. So here we are zoomed in. Of course, you're going to be doing a psychological interview, and you might have a specific assessment tool that's required for your location, or you might have written your own. I remember back when I was working in agencies that accepted insurance, we would have assessment tools that were geared towards each different insurance company because each insurance company has different pre authorization requirements. But at a minimum, You want to understand the specific symptoms that are bringing them to treatment. I like to understand when those symptoms first started in their life, and then also when those symptoms really increased, because that helps me investigate that portion of their timeline to understand what was going on at that point. This helps me understand what was happening to the point that their coping was no longer adequate. I also want to know which symptoms are impacting them the most so we can prioritize their treatment to address this. And I also like to know what increased skills and capacities they'd like to have. Now, for me, during the interview, I do not ask specifics about trauma memories. This is because I don't know enough about this person to know their level of tolerance. Some people can talk about their past trauma without any issues, and others cannot. And so at this point, I don't push for any of the information, which some formal assessment tools will ask very specific and, in my opinion, triggering questions about types of abuse that they survived. I prefer not to ask those specific questions. I want to understand the generalized clusters. Um, was there physical abuse, sexual abuse, neglect, emotional abuse, a combination of the above? Um, and then at that point, if they feel more comfortable, they seem to be doing okay in talking about this in a little bit more detail, I'll ask for time frames so that I have a better idea of when the trauma occurred. For example, if someone had trauma occur when they were quite young and it was ongoing, and multiple types, especially if it was perpetrated by someone who is supposed to protect them, then that lets me know that they're more likely to dissociate in sessions or reprocessing. Let's say someone had a secure attachment with their caregivers and it was a mostly comfortable childhood, and this trauma happened later in life, then there's likely going to be less preparation required. Also, as you can see here, I want to assess for dissociative symptoms. Now, obviously, I'm observing this as I'm in the midst of the psychological interview, but there are also assessment tools that are helpful. The DES, the MID, the DDIS are possibilities. I personally prefer the DSM-5 structured interview. There's a specific breakout module for PTSD that I like. It helps me have a pretty good idea of the level of dissociation that I need to be prepared for. However, I do assume and err on the cautious side that someone will dissociate to some degree, and so I'm prepared for that as well. Another aspect I want to understand is this person's attachment style. For example, again, like we discussed earlier, if they have a secure attachment style, then our treatment will probably progress more rapidly. If they have a disorganized or avoidant or other unhealthy attachment style, I am going to be expecting certain hiccups along the way. You can specifically use the relationship questionnaire. I find it very simple, and it helps me prepare for what the remainder of treatment could look like when it comes to our personal attachment and relationship. Now, next, you can see that I like to coordinate with treatment providers. So if someone was sent to me by a psychiatrist, a medical provider, I get a lot of people who have been sent from their couples therapists because there's personal things that are getting in the way of their couples therapy. So obviously, with the release of information, I'll talk to them, and that will help me know how to better help. And then obviously, I'm writing a master treatment plan. This next section is EMDR preparation. And if you're well versed in the phases, this is phase 2 of EMDR. And zoomed in. Now, I like to give the caveat this phase could take a session, it could take several sessions. If someone has complex PTSD, then it may take several months, depending on how severe the complex PTSD, because everything really is on a continuum. It could take a year, maybe even longer. And so, just going to give you a general overview of EMDR preparation. We want to make sure that each person feels completely informed so they can fully consent to EMDR. And at a minimum, I want them to understand how memories are stored in our brain, specifically regular memories and then trauma memories, because trauma memories are stored differently in the brain. I also want people to understand the adaptive information processing model of EMDR, and then some very common responses and reactions that they can have to EMDR. Now, I've learned that you can never predict how a target or a memory can impact someone, even if you've completed a few targets before with them. Each target can hit someone differently. Though, with specific memories, I like people to understand that during processing, they might re experience portions of the event, though this period is usually only a few minutes at most, and it's not as intense as when it first occurred. That's been my experience. They may also remember suppressed or dissociated material. Now, in my experience, when this does happen, most of the time it's something that they do recall. They just, are putting it together with this specific memory. Now, sometimes on the rare occasion, it could be a surprise and like a brand new memory for them. That's not typical, but on the rare occasion that that has happened, we have paused processing to discuss how to move forwards. Many people actually want to put that memory in the container and then keep going with what we're working on and then return back. Other people sometimes want just kind of a debrief just to sit with this new revelation. Though, again, I want to emphasize in my personal experience, that is not very common. I can probably count maybe 5 or 6 times to my recollection that that's happened. Another thing to educate clients on is that the intensity and the vividness of your memory will likely fade. This doesn't erase the memories, you don't lose the memories, they're just reprocessed the way a typical memory is processed. And most people are ecstatic about this. On the rare occasion, you might have someone who is or will be engaged in testifying on a court trial. In those cases, you'll want to discuss with the lawyer how to move forward. Most of the time, if you are able to videotape the sessions and prove that you're not using hypnosis, which is a big concern in trials, most of the time, if they can see that your EMDR is just that EMDR, um, that's typically not a problem. But again, consult with the lawyer. Now, I also like to let people know that at minimum, they can plan to be fatigued, and oftentimes their mind will be working on this material for the next day or so. It could be kind of going on in the background, or they might notice that they are consciously thinking about this material. And what that is really your brain is just reprocessing that material, and it's just kind of a natural part of memory reprocessing. And so I encourage people, especially at the beginning of our EMDR treatment, to not have something really important scheduled the next day, because you probably aren't going to have the same level of bandwidth that you typically will. Next, I also like to identify what type of bilaterals we're using. Will we be using eye movements? Will it be auditory or tactile? Here, if you're online or in person, you're going to be doing different mechanics to figure that out. And next, you're going to clarify the readiness for EMDR. Does someone have severe medical conditions that you need to consult with their physician about? Stroke or seizure? Um, if you if you have a client who has recent suicidal attempts or self-injury, do we need a self-harm prevention plan in place? Another consideration could be substance abuse issues. Are they in recovery? How long have they been in recovery if they are? Sometimes you're using EMDR addiction specific protocols. And so that's going to also inform treatment. If someone is in recovery, you really want them to have additional outside support, whether it's someone close to them or if they have a 12-step support group that they attend or a sponsor. Any type of support, you want to make sure that that's set up specifically for after sessions as well. And also, I do start very slow when I'm doing EMDR targets. I don't choose a target that has a lot of energy at first because I want the client to have the positive experience of what it's like to clear a target, and it helps them feel prepared for a little bit more heavy targets. And then at minimum, I install a container and a calm place. Other clients might need more progressive muscle relaxation, light stream, guided imagery. Use whatever skills you have in your arsenal to give your client whatever they need to help them feel confident in reprocessing material and then also managing in between sessions. Okay, so the next is EMDR targets. That's this part. Now, this is deceptively simple because I'm going to do an entirely separate educational video on how you identify targets and how you sequence these targets. It is a whole other ball of wax, and in my experience, when I was learning how to do EMDR, I was mostly focused on how to actually reprocess the memories, phases 3 through 8. And I wasn't really focused on how do you sequence the targets for symptom relief. So, my experience is that after I felt more competent in actually processing targets, I then started wanting to get better at sequencing targets appropriately. So this is very basic. You have EMDR's three-prong protocol, which is processing past events first. Then you move to the present triggers, which could be sounds, smells, noises, certain situations, touch. And then you want to do some future templates to build capacity. So, for example, the next time you encounter something that might activate you or trigger you, how are you going to respond while embodying that positive cognition? And that would be your general structure for a single trauma, which again is a very basic treatment plan. And again, as you can see, these are specifically phases 3 through 8. And then at the bottom right here, we have treatment plan updates. I'm zooming in for you. So everyone does this a little bit differently. If you're joint commissioned, then you have to have target dates for when each intervention is going to be addressed. Personally, once I've completed an intervention with a client, I like to document to the left. And actually, we're going to come back to that. But here we've got master treatment plan with just some arbitrary dates in there that I documented to the left. So completing the psychological interview, completed on that date, and so on and so forth. I spend most of my time actually under the EMDR target section, and I'll have specific targets laid out and also cluster them. I do a lot of work with complex PTSD. And so when I'm clustering and then documenting, I like to have the dates down so I can go back and look at specific notes for each target if I have questions or if a client has questions about things. Let's go back here to under treatment plan updates. You want to be sure to document not only overall progress, but any barriers or setbacks. So sometimes someone has a family crisis, they're not able to do processing. Let's say, for example, they're grieving the loss of a loved one, where you're going to be pausing EMDR processing and doing some grief counseling, possibly some crisis intervention. And you're going to be addressing that before you return to EMDR processing. Someone might lose their job. Well, we need to do some work around that and assist them through that transition. So you want to document when these things happen so you have a very good narrative of how treatment has progressed. If there are any barriers, why you shifted from one intervention to another. And so that is how I do a basic master treatment plan. Again, if you're a clinician, I'll be doing a specific video on EMDR target selection and sequencing because that is a lot more nuanced. And again, for my master treatment plans, they take up the bulk of the plan. Thank you for watching. I hope that that was helpful.